in many Black communities, menopause remains something that is not talked about. And so I think the first barrier is the fact that it's not discussed. And I think it's not discussed for many reasons. I ask my patients, did your mother talk to you about menopause? And almost invariably, everybody will say no, their mother didn't talk to them about menopause. And I think it's very complicated because in cultures where childbearing, for example, is very important, a declaration that you are menopausal is a declaration that you are no longer able to have children. And I think that that has quite a lot of complicated implications for many women. And so it tends not to be spoken about. But I think there's also the fact that for many women, they don't know that there's anything that can be done about it. So, for example, many Black women are not aware of the fact that HRT, hormone replacement therapy, exists. So they don't know that HRT is available. And particularly for women living with HIV, I think there are concerns that even if they do know about it, that having HIV will somehow mean that they can't take HRT. And that unfortunately is not just a problem that is restricted to women. I think many clinicians might feel that women with HIV should not, for whatever reason, have HRT, but that is absolutely not the case. And there's no reason that women living with HIV should be managed in menopause any differently to women in the general population.
Thanks very much, Nneka. I mean, obviously, we know that Black women in particular face wider barriers to good health. And there's lots of research that show that Black women may be being treated differently. We're more likely not to be believed when we talk about pain. We're more likely to have our concerns dismissed, more likely to be silenced. And very often when people have these types of experiences, it's understandable why they may not want to go and advocate for themselves